Question 1. When should I see a urologist or urogynecologist? Answer. An individual should seek the expertise of a trained urologist or urogynecologist when he or she is coping with or experiencing symptoms of a condition of the genitourinary tract, including, but not limited to, recurrent urinary tract infections, blood in urination, poor bladder control, urine leakage, difficulty urinating, suspicion of kidney stones, erectile dysfunction, suspicion of male infertility. Question 2. What should I bring to my first office visit? Answer. First-time patients of academic urology and urogynecology of Arizona should prepare and bring the following materials: insurance card, a government-issued photo ID, driver's license or passport, a list of current medications, a list of existing medical conditions, past surgeries, and known allergies. Question 3. What insurances are accepted by AUUA? Answer. Academic urology and urogynecology participates with many of today's leading health plans, including Aetna, AXA, Aspa as Foundation, Banner Health Network, Banner Health Employee Plan, BCBS, TRICARE, Care First, Cigna/Great West, Coventry, Health Choice, Health Net, HMN, Humana, Maricopa Health Plan UPH, Medicare, AE/Medicine, Medicine One, Mercy Care, Phoenix Health Plan/Abrazo, UHC/PSH, Apipa, LifePrint, Scan, USA. Question 4. It's painful to urinate. What could be causing the problem? Answer. There are many conditions that could result in painful urination. An infection of the urinary tract or prostate is a common cause, along with obstructions in the urethra, kidney, bladder, or prostate. Question 5. There's blood in my urine. What may be the cause? Answer. The presence of blood in the urine could be the result of a minor cause or a serious underlying medical condition. To determine the source, a urologist will perform a thorough evaluation. The blood could be the result of an infection, kidney or bladder stones, cancer of the urinary system, or injury. Question 6. Are there different types of incontinence? Answer. Yes, there are 3 types of incontinence: urge incontinence, stress incontinence, and overflow incontinence. Urge incontinence results from an overactive bladder. The bladder contracts involuntarily before a person is ready to urinate. Stress incontinence is the result of the weakening of the supporting tissue and muscles around the urethra and bladder when a person sneezes, coughs, or strains. Incontinence ensues. Overflow incontinence is the result of a blockage in the urinary tract caused by one of many conditions, including benign prostatic hyperplasia, prostate cancer, narrowing of the urethra, urinary retention, etc. Question 7. What is pelvic organ prolapse? Answer. Vaginal or pelvic prolapse occurs when structures, like the bladder or rectum, bulge or protrude into the vaginal wall as a result of the weakening of the supporting tissues. The severity of prolapse varies, but it can cause many unwanted symptoms, including urine leakage, pelvic pain and pressure, difficulty urinating or passing a bowel movement, recurrent urinary tract infections, and painful sexual intercourse. Vaginal and pelvic prolapse is often the result of childbirth, aging, or pelvic surgery. Question 8. What are the symptoms of BPH? Answer. As men age, the prostate enlarges as a result of the hormone testosterone. This enlargement of the prostate is called benign prostatic hyperplasia (BPH). As the prostate enlarges, the flow of urine is restricted, causing a number of symptoms, including a weak urine stream and a more frequent need to urinate. Question 9. When should I start to receive prostate cancer screenings? Answer. For most men, prostate cancer screening should begin at age 50. If you have a family history of prostate cancer or you are of African American descent, screening should start earlier, at age 40. Prostate cancer screening consists of 2 tests: a digital rectal exam (DRE) and prostate-specific antigen (PSA) blood test. Routine screenings are critical for early diagnosis as prostate cancer rarely produces symptoms until in its later stages. Question 10. What are the symptoms of kidney stones? Answer. If you are experiencing sudden and severe pain in the back, side, abdomen, groin, and genitals that increases in waves, you may have a kidney stone. Other symptoms include nausea and vomiting, the presence of blood in the urine, and frequent and painful urination. Question 11. What causes kidney stones and how can they be prevented? Answer. Kidney stones form when there is a prevalence of stone-forming substances in the urine, such as calcium oxalate and uric acid, and not enough fluid to dilute these substances. To determine the cause of stone formation, patients may undergo a 24-hour urine collection process. Based on the findings, a number of preventative measures can be taken, including increased water intake, less oxalate-rich foods, a diet low in salt and animal protein, a cessation of calcium supplements, medication. Question 12. What is a urogynecologist? Answer. A urogynecologist is an obstetrician/gynecologist who has specialized in the care of women with pelvic floor dysfunction. The pelvic floor consists of the muscles, ligaments, connective tissue and nerves that help support and control the bladder, uterus, vagina and rectum. The pelvic floor can be damaged by childbirth, repeated heavy lifting, chronic disease or surgery. Question 13. What is the pelvic floor? Answer. The pelvic floor consists of the muscles, ligaments, connective tissue and nerves that help support and control the bladder, uterus, vagina and rectum. Question 14. How can the pelvic floor become damaged? Answer. The pelvic floor can be damaged by childbirth, repeated heavy lifting, chronic disease or surgery. Question 15. What is incontinence and pelvic floor prolapse? Answer. Many women consider the leakage of urine to be normal. The problem is common but is not normal, and in most cases it can be treated. Urinary incontinence is a symptom of a physical problem, not a disease in itself. Research has shown that 1 in 4 women aged 30 to 59 experiences incontinence. When a woman's female organs or bladder bulge, sag or fall out of the normal position, this is called a prolapse. Pelvic floor prolapse can occur quickly, but most often it occurs gradually over time. Many things may contribute to pelvic prolapse, including family medical history, childbirth, prior surgery and chronic constipation.